All right, and we are starting on our next section of Unit A, and we're going to be going into specific disorders. And the first one we're going to talk about is anxiety disorders. Remember to pause video so that you could write down the characteristics or the symptoms for each one of these different disorders. Okay, so let's start with what is considered an anxiety disorder. And this is basically, it's characterized by a distressing, persistent anxiety, or maladaptive behaviors that are used to reduce anxiety. Okay, now under anxiety disorders, there's a few that are considered under here, and they are called generalized anxiety disorder, panic disorder, phobias or specific phobias, obsessive compulsive disorders, and also post-traumatic stress disorders. Okay, so we're going to start with the first one, which is generalized anxiety disorder. And I just want you to keep in mind that though we all experience anxiety, and so what defines what is just regular anxiety to opposed to a generalized anxiety disorders is, and you'll see the criteria for a lot of these like very common behaviors such as anxiety, the criteria for that disorder is a lot higher, right? Like it has to show a lot more symptoms than just being anxious, right? And then it also needs to persist, which is key, for more than 6 months. Okay, so this is something that's important because it's not just like, oh, I'm anxious because of, right before the test, right? Like in April, people tend to be a little bit more stressed and anxious. Um, but for generalized anxiety, it has to pass that time, right? Like it has to last for 6 months or more. So remember to keep that in mind. Now, this is an anxiety disorder is basically that the person is continuously tense, apprehensive, which is either suspicious or fearful, are in a constant state of that autonomic nervous system arousal, right? So their sympathetic nervous system is always on the go. So some of these other symptoms that need to be present, okay, is that they're worrying continuously, they're often jittery, agitated, they can't sleep, right? Or they have difficulty concentrating because they're so worried. They're constantly worried about something. Their facial features also may be like very tense, fidgeting, um, and so sometimes it can be accompanied by maybe like a depressed mood, okay? Um, and basically, all of these disorders, just keep in mind that it has to be it must affect their day-to-day life, right? So it must be preventing them from doing this everyday life or taking super long for them to do it. Okay, now the next one is called panic disorder. So very much like they have that anxious, like all of these kind of have that anxious, like continuously tense and worried part of it, and then they just kind of like drive off into something a little bit more specific. With a panic disorder, they have the same thing. They always have like it's like this sudden fear, severe feeling of extreme anxiety or fear that something bad is going to happen. And then that manifests into a panic episode that comes on quickly, like suddenly. And sometimes it lasts about a minute, a few minutes, okay? And then it's like a physiological response to the anxiety, right? And then which they'll call a panic attack. And then this is like a really intensified moment for the person in which their heart starts beating, they can't breathe, they start feeling like they're choking, they're trembling, dizzy, right? They feel like they're having, many times, it feels like a heart attack that they're having. So, which then this also increases, this is the thing about panic disorders, it then is gets I forgot the word, but it gets like it's also escalates, right? Because they feel like they're having, a heart attack or they can't breathe. So then that creates even more anxiety. And so it just like manifests itself to worse. Under this one too, they may experience what's called de um, derealization. Okay, make sure to write that down, which is basically feeling like they're not in reality. Okay, and then depersonalization is this feeling that they are detached from themselves. Okay, like they're not experiencing this. So they could feel that as well. Um, so we'll talk a little bit about when somebody is having a panic disorder, of what are some strategies to kind of bring them back into the moment. What don't tell somebody that's having a panic attack is to breathe, okay? Because they're trying, right? And that's just creating even more anxiety that they can't breathe. And so it just escalates the situation more. Okay, now the next one is what's called specific phobia disorder. I don't have it there, but just write it like that, specific phobia disorder. And this is an anxiety disorder that's marked by persistent, irrational fear and avoidance of either a specific object, an activity, or a situation. Okay? So it's make sure that you note that it's an irrational fear and avoidance of certain objects, activities, or situations. Now, they person with a specific phobia, they'll become incapacitated by their efforts to try to avoid the feared situation. So they'll do whatever they can to avoid those situations. Sometimes they're a little bit more specific with like animals, insects, heights, and a lot of that has been linked to the evolutionary because it's meant for survival. And there's also what's called social anxiety disorder, and I want you to write that in there under phobias. And social anxiety disorder is basically this overwhelm with anxiety and fear when they're in a social situation, okay? And it could be a small setting, it could be big settings. It just depends on the person's perception of that social setting. And there is an intense fear of being scrutinized by others. They try to avoid potentially embarrassing social situations like that they can mess up, or even like if they're afraid of, like if they're at a restaurant and the food spills on their shirt, or if they trip over something, or, so they have this immense fear that that will happen, so they avoid it altogether. Um, Now, there's another one called agoraphobia, and I'll write it down. And this is where a fear of open, crowded, or enclosed spaces. Okay, so this could be anywhere from like shopping, malls, to the movie theater, to just like an open field. Okay, they may avoid going outside or going anywhere where there's crowds or people, elevators, and many times people that have agoraphobia, they are also linked to having panic attacks. So make sure you don't have that in there. And they definitely will feel a lot safer if they are at home. Okay, so usually they're they feel comfort in home because it's safer. And then we go to obsessive compulsive disorder, okay? And obsessive compulsive disorder has a lot of misconceptions in society, as well as a lot of these, like agoraphobia, social anxiety. Like, they're just because we see, let's say, see it in the movie doesn't always necessarily mean that that's they portray. that disorder correctly. Okay, and we'll talk a little bit more on some of those misconceptions in class. So we'll get into the obsessive compulsive disorder, or many people know is OCD, and one that tends to be overused a lot, especially if you see that, oh, I'm very clean, or I like my neatness, like my OCD is kicking in, like, so it's kind of like our society has overused this word without really understanding what it really means for somebody that has OCD, or obsessive compulsive disorder, how difficult and time consuming some of these things can happen. So, really be more conscious of it, especially if we see that being said around when, if you're not diagnosed with that, from a doctor, we shouldn't be using that and saying that, because we just never know who is dealing with any of these disorders. And we'll talk about like that, this one, and a ADHD, right? Another common one that everybody kind of throws out there as well. So, what exactly is obsessive compulsive disorder? And this is basically an unwanted repeated thought, right? And that's why it's called the obsession. That's the obsessive part. Like, then that comes from the anxiety, right? Like that overthinking repetitive thoughts. And then it leads to an action, which is then the compulsion. Okay. Now, what ends up happening is that there will be an obsessive thought that goes continuously, and it won't go away until there is like a compulsive ritual that it tends to be time consuming. And then that ritual or compulsion will reduce the anxiety that the thought has. And so it alleviates that until the thought comes back again, right? And then the person will kind of, it's like this little vicious little cycle that they go through. Now, the person knows that it's irrational, but their obsessive thoughts doesn't allow him to step away from that. Okay. And they tend to repeat the task over and over again till those obsessive thoughts are released for a little bit. Now, they have found that the obsessive thoughts can be rooted in some form of neurochemical imbalance, and they've linked it to the neurotransmitter of serotonin. Okay, so keep that in mind. Now, under the obsessive compulsive disorder, there could be other types of OCD disorders, a form of it, which is hoarding disorder. And it's not on there, but I'm going to write that in there, which is hoarding disorder. And this is that the person has this obsessive thought that something like an object has, it's linked, it's tied to something that's important. Either it has of some value, or that, if they throw this away, something bad might happen. So they keep things, they have a hard time letting go of anything. Okay, and then there's also what's called body dysmorphic disorder. And I'm writing that in there. It's a Y disorder. So body dysmorphic disorder is basically this obsessive preoccupation with his or her physical appearance. And then, so that's the thought, right? The obsessive thought. And then it tends to follow through with some form of like a compulsion or an action, which is typically they'll pick at their body parts, or they'll look at themselves in the mirror, and then that will maybe reduce, right, like that anxiety, or it may amplify the obsessive thoughts. So, and that is pretty much it when it comes to the obsessive disorders. Now, trying to understand anxiety disorders and some of the perspectives, okay? And we'll look at what is the behavioral or slash learning perspective, which will also incorporate some of the cognitive. Okay, so from the behavioral perspective, they believe that a lot of these classical and operant conditioning have been linked to what creates these fears and general anxiety, right? So if it's been, through classically conditions like fears, right? Those are fears are quick to be learned through classical conditioning. And then, of course, operant conditioning, reinforcements, and punishments can create this anxiety. Um, and basically, they've linked those two together for some, right? For some of these for these anxieties. Now, there's also could be, they've linked it to generalizing, right? Generalizing, let's say if they've been attacked by a dog, then they may create the fear for all dogs, right? So create a phobia. Um, it also could be because they're reinforced, right? So they may help, the reinforcement may help maintain some phobias or some compulsions because, like, again, it's like a more negative reinforcement, right? You're removing something unpleasant, and so you're gonna do it again. Okay. Another thing is observational learning, right? They learn these fears by watching other people be fearful of things. And then another one is cognition, which is basically the cognitive approach. Would look at it as the way that a person's interpreting um, the events or the stressor, and their irrational beliefs. Okay, and it's all cognitive. That's what causes the anxiety. And this is where you'll see where when you're working with somebody that has an anxiety disorder, typically they'll use what's called the behavioral cognitive approach, which they're going to use behavior, right? And then the cognition, kind of mixing them both to address them. All right. And then there's also the biological perspective. And they believe that we can understand people's phobias due to natural selection, right? That we are biologically prepared to fear things that are going to basically um, be like, we could lose our life because of that. So they're saying we have these fears and anxiety because of natural selection, as well as genetics, right? There is some genes, they've linked some genes that there's people that are more anxious than others. They've done an identical twin study that ended up having similar phobias, even though they um, were raised separately. And then they've also identified 17 genes that appear in express like the appear to be expressed with people with anxiety disorders. So there is some link to the genetics there. They say there is some levels, serotonin is linked to this, as well as glutamate. Okay. And then the brain, as they say, that all anxiety disorders are manifested biologically as an overarousal of brain areas, okay, that are involved in impulse control and habitual behaviors. So, the brain obviously is activated, but they say that certain parts are specifically activated for people that have anxiety disorders. All right, and that's basically it. We'll definitely talk a little bit more about this in class.